So, one of the things I want to help people understand is what exactly you do. I know you're a physician. I know you have specialties with really young babies.
So I am a neonatologist, babies, newborns. Basically, we're a subset of pediatrics, and our focus is on sick and premature newborns. We care for babies in the neonatal intensive care unit.
Premature babies.
Correct. Babies born before they are truly ready to be outside of their mother's wombs.
When would ready to be outside happen?
Term actually refers to babies past 37 weeks gestation,
Okay,
right?
37 is normal.
Right. Your due date is at 40 weeks gestation. 37 to 41 weeks gestation is considered term. Before that is considered preterm.
In your own personal experience, is there a case that stands out?
So the maternal fetal medicine specialist, that's high-risk obstetrician, an obstetrician
okay.
who handles high-risk deliveries. They call me up and say, hey, I've got this mom who has whatever diagnosis, and they really need to speak to a neonatologist because this diagnosis has a very poor prognosis. We would like you to work with them on what does this mean before delivery, at delivery, and then after delivery. One particular case, a family came in, mom and dad, and they'd been referred by the maternal fetal medicine specialist, and their baby had a pretty tough diagnosis. When I saw them, they were at 24 weeks gestation. Still pretty young.
Right on the edge.
I knew this family from a previous child in our unit, so we had a rapport.
Oh, yeah.
And I asked, what did the maternal fetal medicine specialist tell you about the chances for this child? And they said, well, he told us there's probably like a less than a 1% chance of surviving this. I said, I actually agree with that. I think there is probably a less than 1% chance that your child is going to survive this. If the child makes it after delivery, there was a big chance that this baby was going to die in utero, an intrauterine fetal demise. And they said, if the baby dies in utero, then that's one answer. If the baby actually is delivered, we would like you to do everything you can to help this child within reason. We trust your judgment. They said those words to me. We trust your judgment. Okay, there's two ways to look at that. First of all, holy mackerel, that means I have to be the one to decide. Well, that's my job.
Right.
That's what I'm supposed to do. I'm supposed to be able to look at a situation and try and decide in a split second what makes the most sense for this child. The second way to look at that is like, whew, okay, they trust me. So really, at this point, I can just go with my gut. I can go with what I know about the chances of a child, how much is too much. Then we set this up, and I know that they would really like a chance to meet their child. They'd like a chance to hold their child, if at all possible. If there is something I can do to help their child survive, they would like that too, but within reason.
And
Don't
as
do
you
chest
just said, how
compressions.
much is too much,
How
right?
much
Is
is
there
too
ever
much?
too much? Yeah.
Sometimes there's too much because there's this burden of suffering.
Suffering of the child, the
The
parents?
suffering of both.
Oh, yeah.
The suffering of
All
both. First of the
parties.
burden of the
And
suffering
what
for
about the
child.
suffering that you and your team go through?
Right.
Right.
The family leaves. I write up my letter and I try and make my team all aware that this is what the family would like. And then they come in and mom's in labor and they have to get this baby out. The baby's still alive. And I'm in my office. So
Very
I run
nice
down
office.
and I find the neonatologist on call. And it's my medical partner. The neonatologist on call, he's the doc who built this unit.
Oh,
He's
right.
been here for
Okay.
40 years, right? This is
Cool.
my mentor. And this is the man I can trust will absolutely, because he's the one that taught me this. It's not just about what happens with this baby. It's about what happens with this
he has a whole
baby.
picture in ways that others wouldn't.
Exactly. And what does that do to this family? What do they remember? What do they see? How supported do they feel? Because if they don't feel supported, if they don't feel like the right thing was done for their baby or the best thing was done for their baby or that people tried to do their best for this baby, then they have this horrible or lack of peace, I suppose, right?
The downstream
Right.
effect, if you will.
I know his objective is going to be to do what he can to give this family peace without going too far. But, I have a whole other team on call that day, and the charge nurse is coming down the hallway saying, are you serious? We are really going to resuscitate a baby with this? And I'm, okay, hang on. Let me talk to you a little bit about what that conversation was like with the family.
Because the team haven't been involved in any of these conversations thus far.
This
Right.
team on call, it's been other people involved in
Okay.
these conversations, and then, we're kind of the emissaries, if you will.
Right.
So it worked out beautifully. The team got together before the baby came through. They assessed the baby after after the baby came out. They did a couple of things to try and help that baby survive a short length of time. They knew this baby wasn't going to survive. But in order to get that father in the room and the siblings in the room and the mom who just had a C-section, get her, out of the operating room and
Bringing
then
all
over
these
into the
pieces
NICU.
together.
He did a couple of things that we wouldn't normally do for a baby unless we were expecting them to survive longer period
sure.
of time, intubated, and gave the baby some medication in the baby's
And
lungs.
allowed them
try and
time
help her.
together.
Yes,
Yeah.
that was it. He was basically buying them time. The question becomes the burden of suffering. We bought time for the family. What did that cost the kid?
It's hard to know the experience of a baby. I mean, the communication is not an easy thing.
Right. I trusted him to not go too far without me having to tell him this is what is defined as too far, because too far is different for every child in every family, which is why we have these conversations with parents who might be delivering at 22 to 23 weeks gestation. Below 22 weeks gestation, we don't attempt resuscitation because we don't have the equipment to be able to do it, but we have had some success between 22 and 23 weeks gestation. So that conversation with these families about the benefit versus the burden of suffering, and how do you feel about that? Like I said, this mom told me, all right, less than 1%, but you're not telling me it's zero.
Right. And what parent wouldn't want to experience that 1%?
If there's a 1% chance my kid's going to survive this, please try. It's so funny, Mark. I will tell you that when you go into neonatology, right, they ask you, why do you want to go into neonatology? We love babies.
Yeah.
What I'm finding is that I fall in love with their families.
Oh, yeah.
People say, I'd go into pediatrics except for they come with parents, right? Parents can be, painful. I'm a parent. I'm painful sometimes. I know that. But you fall in love with these families, with these parents.
Thank you, Mary Alice.
You're welcome. Thank you, Mark.